Hello, Dr. Green here. Firstly, welcome back to Durrington Surgery. Thank you for all your support, and particularly over the recent months. It's been a challenging time to say the least. We're going to run a short video about the flu jab. We hope it's informative, and if you have any questions, please ask the clinician when you meet them in a few minutes' time.
Hello, I'm Jess. Influenza, or simply the flu, is caused by the influenza virus. It is one of the most common infectious diseases. Almost everyone has had the flu at some point. High fever, runny nose, sore throat, muscle pains, headache, coughing, sneezing, and even feeling tired. It's terrible, you'll remember.
Hello, I'm Lauren. The good news is it usually improves, but for certain groups of people, flu can cause serious complications such as pneumonia and even death. It's especially dangerous for babies, pregnant women, people aged over 65 years and those with certain medical conditions. So even if you are healthy, it's important to get a flu jab to protect others.
Hello, Fran here. Flu spreads when a sick person sneezes or coughs, sending thousands of virus-containing droplets into the air. If they're lucky, these viruses might land directly on another person's nose or mouth. Well, lucky for them, not for the person. But more often, they usually end up landing on nearby objects, like a table. But that's not the end. The flu virus is very hardy and can survive for hours in the environment. This means hours later, another person touching the table may be contaminated by the virus. To make matters worse, a person may be contagious the day before their symptoms even begin and up to 2 weeks afterwards, even when they feel so much better. So if you don't want to feel awful for a week, or make your family, friends or co-workers sick, the best way to prevent flu is to get the flu jab.
Hello, my name is Dr. Woodman. I'm one of the new GP trainees here. The NHS offers the flu vaccine free of charge to people at the highest risk and its complications. This includes pregnant women, adults aged over 65, children aged 2 and 3, children in reception and years 1 to 7 at school, and children and adults with certain medical conditions such as asthma, COPD and heart problems. It's also available to those of you who are in receipt of carer's allowance or who are the main carer of an older or disabled person or live with someone who is on the NHS shielded patients list. The best time to be vaccinated against flu is in October and November before the flu starts circulating in December. However, it's never too late. Having the flu jab any time before March is better than not being vaccinated at all.
Hello there, I'm Dr. Hayden. I'm one of the new GP trainees here at Avon Valley Practice. Getting vaccinated is easy. For adults, the flu vaccination is given as an injection with a small needle into the upper arm. It only takes a few seconds. The flu jab contains the types of influenza virus that are predicted to be the dominant ones this winter, as it's impossible to vaccinate against all the strains of flu virus. This year, the NHS recommends adjuvanted trivalent influenza vaccine, ATIV, for people aged 65 and over, and egg-grown quadrivalent influenza vaccine, QIVE, or cell-based quadrivalent influenza vaccine, QIVC, for people aged under 65, and these are the vaccines we're offering at Avon Valley Practice. In children, the flu vaccination can be given as a nasal spray. This is pain-free. Usually it only needs to be given once, but for children with certain medical conditions, it may need to be repeated a few weeks later.
Hello, I'm Susie. I'm here to talk to you about the side effects of the flu vaccine. Fortunately, there are few side effects from the flu vaccination. For adults, your arm may be a bit sore and you may have a mild fever and achy muscles for a couple of days. Serious side effects are very rare and it's not recommended for people with life-threatening egg allergies or a history of Guillain-Barré syndrome. Remember, you cannot catch the flu from the flu jab. The virus inside the vaccine is dead. It can't infect you. Otherwise, it's good to get vaccinated.
Hello, Kathy here. To wrap up, the flu jab is recommended to everyone over 6 months old with a few exceptions. The flu jab is the best way to prevent flu. Getting vaccinated also decreases the chances of you passing the flu to someone else. Therefore, the more people who are vaccinated against the flu, the less people who will contract and spread flu. This protects those who can't get vaccinated, like infants under 6 months old. Remember, if you're having the flu jab because you are immune suppressed, please ask those who live with you to get vaccinated as well. It's good to get vaccinated.